YouTube, and welcome back to my channel. In today's video, I'm going to address a question that is asked often when I do my treatment modality class. For about 7 years, I did a treatment education class for patients who in the near future we're probably going to need dialysis. So in the class, I would do education on what in-center is like, what home dialysis is like, some of the things you need to know about kidney transplantation. And of course, I'd ask the clients, there, hey, anyone have any questions? Feel free to, ask questions. And invariably, I get this question probably once a month when I would teach the class. A patient would always ask, Stephanie, I know in-center is 3 days a week. What happens if I miss a treatment? I had to be very careful how I answered this question because I certainly didn't want to encourage patients to start off not adhering to the dialysis prescription. So before I go into the answer, I'm going to talk a little bit about the dialysis prescription for in-center because that's the treatment that most of the clients selected was in-center dialysis. Probably about 60 to 70% of the time, the clients would select in-center dialysis. In-center dialysis is usually going to be 3 days a week, around 4 hours, depending on how big the person was, what kind of access they had, and what have you. So I'm getting to the answer. I know I'm taking a while, but how I would answer this is I would say, well, the recommendation is 3 days a week, right? And some people are able to miss a session and not have any issues, right? That's what I'd say. I said, hey, some people could miss a session and not have an issue, but then one person could miss a session and end up in the hospital, or worst case scenario, could pass away. That has actually happened where patients would miss a dialysis session and then, unfortunately, their family members would find them deceased at home. So it's nothing that we ever encourage a patient to miss a session, and patients have the right to attend the dialysis sessions as they see fit, because things come up in their lives, people have issues with their access, people may have issues with transportation, it may be inclement weather outside, but my personal advice to people is you always want to go to dialysis because you never know when you're not going to be able to go and it's totally out of your control. What does that mean? Let's say there's a storm coming up and your dialysis is due on Friday, but the storm hits Thursday night and you literally cannot get to dialysis, right? What are you going to do? If you have been always going and being strict with the diet, usually you may not have issues, but let's say you took Wednesday off because you kind of didn't feel like going. And so guess what? You didn't have dialysis Wednesday, you didn't have it Friday, you're not going to have it again until Monday. You may be in some serious trouble. So I kind of liken going to dialysis kind of like going to school. It's kind of a simple analogy, but if you always go to class and you always take notes and you always pay attention and do the work, chances are you're going to pass the class, right? Dialysis is kind of the same way when it comes to not going. If you always go when it's within your control, the time that it's not within your control and you don't go is not so bad as when you half go all the time. And then when you really need to go because you got a bunch of fluid on and you feel like crap, and then you actually cannot go. Those are the times where people actually, they expire because you can only push your luck so much, and you don't know if you're going to be the patient who misses a treatment and you're in the hospital, or if you're going to be the patient that misses a treatment and then you expire. You really don't know. But I know no one is perfect and you can't always make your sessions. I do realize that. But I always tell people, if it is within your control to go, it's better to go because you don't know when it's not going to be within your control to make it to dialysis. Because remember, dialysis is removing fluid from your body, and it's removing poisons and toxins from your body. And in-center dialysis only gives you 25% of what your native, natural, perfectly working kidneys used to do. So even in a perfect world, when you go all the time for in-center, you're only getting about 25% cleaning of what your old kidneys used to do. And you compound that with missing a session, you're getting even less of a cleaning. And so they've actually done studies probably over the past 20, 30 years that prove that one of the biggest indicators to a long life on dialysis is actually going to dialysis. That is the biggest thing within your control to affect the quality of your life, is just actually having the treatments. So I know that was a long, drawn-out question, and that's exactly how I answered it in my class, that, hey, you never know when you're not going to be able to go and it's out of your control. So please always go to the best of your ability. Always try to go. Alrighty, this video was a little shorter than the others, and I appreciate you taking the time to tune into my channel and support my channel. And please subscribe. I put out videos weekly, really good information to encourage kidney patients, so family members and support persons of kidney patients can kind of learn more about what they actually go through and what you can do to help support that loved one in your life dealing with this, devastating condition.